Hello, my name is Felicia Taylor. I'm an ECPI University student. This is my senior practicum. Dr. Townsend is my instructor. I'll be talking to you about a plan that we want to implement in my facility. We have noticed an increase of elderly patients, so we want to find out which one of our patients is at risk for falls. So we want to start a fall prevention and precaution protocol. This project consists of training staff on how to design, implement, and evaluate falls within a training facility. Our three objectives is to design a plan for fall prevention, to implement a new fall precaution procedures within 2 weeks, and to evaluate the effects of the fall prevention procedure. First, we wanted to interview staff to discuss who was at greatest risk for the falls. We came together and we decided that patients that is over 65 and older, seem to be the ones that are most at risk. So what we did was we start going through charts and of new patients that came into the facility to see which patients were over 65 years of age. After we completed going through the charts, anybody that had a disability or over 65, we put those charts to the side and we implemented a plan. Okay, we designed a plan for fall risk assessment for all patients admitted to the facility. And we also started a post-fall assessment as well. First, we start assessing all our new patients that entered the facility, assessing the older patients for mobility. If they have any diagnosis or multiple diagnoses, we check them for their mental status or any history of falls. And then falls in the older adults can lead to more serious injuries, so we want to make this project our priority. We also wanted to notify our team. So our provider, physical therapy, we want to get everybody involved. Once we can distinguish which patients were over 65 and older, who has multiple diagnoses, who has any mental uh, illness, or who are prone to falls or have fall in the past, we wanted to include all our team to give them continuum of care. Okay, diagnose, once we determine that our patient has a risk for falls, then we start assigning them to the nearest nurses station. So we want to put all our patients that we determine that's at risk that falls, put them in front of the nurses stations or on the side of the nurses stations. We also want to put up signs to let everybody know that these specific patients are at risk for falls. And then we want to orient our patients to their surroundings so they know where they are at and where the bathrooms are at, their beds, or the cafeteria, anything that we felt that they could fall or get confused and slip and fall. Then the patients that needed like assisted devices, we also demonstrate to them how to use these devices, like a cane, crutches, walkers, or how to work the wheelchairs, or even them sitting in jerry chairs. Some of the patients also need like chair alarms or bed alarms or some type of mobility monitor for wandering. So we also want to let them know what each device was so they can be aware why they are wearing it, and staff also can show them how to use these assisted devices. We also have like a post-fall assessment as well. Even though we implement this prevention of falls or these patients at risk for falls, we certainly know that someone might fall. but we wanted to know like where most of the falls would happen, was to be like in their bedroom or in the bathroom, or them looking for something, or getting up from a chair. So we also, want to make sure our patients are mindful with that. Let staff know when they're going to the bathroom or when they're ready to get up. Or we can make rounds, like rounds every 2 hours, checking on our elderly patients. Well, the outcome of this project was very successful. We observed staff putting up signs for at-risk patients, assigning them to different rooms, educating patients on assistive devices. Everybody worked together, our providers, our physical therapists, so it all came together well. I was very happy with the project. Um, One of the primary concerns in corrections is fall prevention and fall precaution. I really enjoy teaching the nurses about the prevention, and I think the learning strategies that we all talked about, and what we put together help and implementing this plan and in decreasing injuries. Um, Within the past 2 weeks of implementing this plan, there was no falls in the infirmary. So that was great. And our signs was visible to staff, and that patient was that we know have risk for falls was around the nurses stations. So and that's another thing, the staff was able to identify like which patients was at risk. So with us working together, going through their charts, assessing the patients, evaluating them, we got to know which one of our patients is at risk for falls. This was a very interesting project. I was very happy with it. We had a quiz at the end of our training session, which I was very happy with. Everyone passed, and we had a survey on my teaching skills, and as well, how they enjoy um, volunteering and working together, and everything was wonderful. And I was glad that everything worked out well, and our plan was implemented, and the staff conducted it, and the, the patients seem happy, staff seem happy, and I hope we can continue with this new protocol or updated protocol on fall precaution and fall prevention. Um, Thank you very much. I enjoyed this class. I enjoyed doing this project, and hopefully we can do more projects like this, especially at my facility. And I'm already thinking what is next. What's the next project I can implement? Thank you.